Colorado's largest healthcare system has a new policy, and it has to do with organ transplant surgeries. Effectively, if you are not vaccinated, you're not gonna get one. Not in the near future anyway. They say that this rule is to protect patients, but of course, any denial of service, especially something as significant as organ transplants, is gonna make this very controversial. And so people have strong opinions. So let me give you their argument for why they're doing this first, and then we'll have a little debate. So UCHealth put out a statement saying for transplant patients who contract COVID-19, the mortality rate ranges from about 20% to more than 30%. This shows the extreme risk that COVID-19 poses to transplant recipients after their surgeries. They said the purpose of the vaccine policy is to protect the health of its patients, and that transplant centers across the US have such requirements in place. So to give you an idea of the context, in Colorado right now, they have about 62% of their population vaccinated. Just a little bit higher, I think, than LA County. And so at least one woman who has, as of right now, stage 5 renal failure, she had been apparently months away from getting a new kidney. But now with the new policy, neither she nor the kidney donor are vaccinated. So unless that changes, and she apparently is being given 1 month for that to happen, she will no longer be eligible for that transplant. And at least the donor says they are not vaccinated for religious reasons, I believe. The individual getting it isn't vaccinated, but we don't exactly know why. So we have some more information on this, Adrian, but what do you think about the decision by UCHealth here?
You know, as much as I want to say that I completely understand and I think it's a great idea to encourage people to get vaccinated, at the same time, when you have people here who've been on these lists for a long time and they're looking for that hope to survive, I don't know, I think it's a tough one. I really do.
I do, and I'm trying to grapple with it. I mean, certainly you could have had a grandfathering in clause in theory. Like in terms of the actual human cost, not allowing someone to get it done isn't substantively that different from someone was about to get it done and now you've stopped them. In both cases, the person doesn't get the transplant. But as you point out, if you got a donor, like it's already so unlikely to happen. People die every single day for not receiving an organ donation. That would be on a personal level, on a family level, particularly devastating.
Yeah, and I guess there'd be exceptions for what if you cannot even get the vaccine because your immune system is too compromised in some way and you just can't get it medically. Then, will they withhold you from being able to get, I really don't know what their exceptions would be, but this kind of seems a little on the cruel side.
Yeah, I don't know. In this particular case, I didn't see anything about them being physically unable to get vaccinated. They just seem to not for religious reasons or something else. And I would, just out of your own personal human curiosity, I would be interested to find out exactly why. Because what's the worst thing you could be afraid of the vaccine? Is that after the nanobots take over your body, it kills you inevitably. It's gonna kill all the vaccinated. Well, not getting the organ is also probably gonna kill you. So kind of seems like that would wash out. But anyway, I cannot speak to these individuals. Now, in terms of the argument, it seems to be twofold. So one is, after a transplant, your body is more vulnerable. And so there's a variety of things that could be more dangerous for you than it would be for someone who had not just received a transplant. That mortality rate is very high. If you receive COVID, and we're in a spike right now, if you're not vaccinated, there's a not insignificant chance you could get COVID. The counter argument to that would be, well, if you don't get the thing, you're gonna die anyway. Not all transplants are necessarily gonna be that cut and dried, but so that's sort of a patient-focused part of this. The other is, if we have a limited supply of each type of organ, which we do, there are not enough organs to go around, they already limit a lot of stuff about you. You're expected, in many cases, to be on particular diets, to stop things like drinking, smoking, to exercise, a variety of things to make it most likely that you won't reject the organ, which would be catastrophic for you, and also, in hindsight, a waste of the organ that could have gone to someone else. So if they can make those sorts of requirements already, this seems like a pretty significant one in terms of the likelihood that you might die and thus have wasted the organ. Does that sway you at all?
I would honestly say to some extent that does, because by virtue of the fact that you could end up wasting the organ because your immune system will be lowered and there's a chance that your body may not take it, it should go to someone who has a higher chance of actually being able to survive with the organ because of the choice that they made to get the vaccine. Yeah. So I could see that as being a persuasive element, but definitely not to encourage someone to get the vaccine or to punish them for not having it.
Yeah. Yeah, well, look, also importantly, and I should have mentioned this before, but one of the things they already require is taking certain vaccinations. So taking a vaccination to get it again isn't a new thing. Now, I know we've had versions of this for things like the military being required to get vaccinated or vaccinations for overseas travel, things like that. It has always felt like it should be more persuasive than it is that you already get vaccinations to do things like go to school. Unfortunately, it falls apart in that they believe that these are different, either because they're too new, regardless of what the FDA said, or because they're mRNA, although again, not all of them are. That isn't persuasive to them. So yeah, I mean, to me, the fact that you already are required to get vaccinations or to take particular types of medication, they require you to take things that would suppress, for instance, your immune system to lower the chance that it rejects the organ. They have control exerted over you about what you put into your body if they're gonna put this organ into your body. So is it just, like, we feel uncomfortable, a bit queasy, we cringe at it, but is it substantively different than what already existed pre-COVID?
No, not at all. No, I don't think it was at all.
Yeah, I don't know. I'm uncomfortable about it. You might not, like people in the audience might think, well, John, you've been like more frustrated than anyone about people who refuse to do what's necessary. But I don't know. It is, when it's about an organ, when it's about living or dying, it makes me uncomfortable. But again, I'm not necessarily convinced it's different. I really wish that we should do a poll on this. Should you limit organ transplants as a result of that? We might work on that. And by the way, about 17 people die every day waiting for an organ. So we don't necessarily always end every story with telling you what you can do to help, but it's pretty clear that becoming an organ donor could help in this particular case because long after COVID's not a thing that we're talking about anymore, there are still gonna be people that need these organs. They are still gonna be dying a dozen or more every single day. And by becoming an organ donor, it's an easy, cost-free way to potentially help with that. Oh wait, we do have a poll for this actually. I should have scrolled down more. Oh, what do you know? They really thought ahead. Thank you, Brett, for not cheering in my ear about that. Anyway, you can go to tyt.com/polls. The question is, are hospitals right to deny transplants to the unvaccinated in almost all situations? So there's nothing I love more than the polls where I honestly do not know where the audience is gonna come out. And so we'll have to see about that.
Thanks for watching the Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.